Hi, I'm Marvin Plackett, and today is Monday, November 16th. Greetings to all residents, to all staff, to all guests. Currently at this time, we have 11 active COVID cases. We have 4 residents and we have 7 staff. And the 4 residents are all on our dedicated COVID unit at Episcopal Church Home. And when I last spoke to you, we had 5 residents. The one resident that was located that was living temporarily in another nursing home in the metro area, that person is returning. They are COVID free. They're returning to their gardens, home, and we congratulate them and welcome back. So glad you're back with us and that you are recovered from COVID. And the 7 staff, they of course are at home recovering, and they will not be scheduled to work until they are completely COVID free. The additional staff that appeared over the last few days, they were ones that were scheduled at the gardens, primarily 2nd and 3rd floor. And so once again, they are at home recovering. And we look forward to them returning as soon as they have fully recovered. Testing, of course, continues at Iris Park Commons, the gardens, and Episcopal Church Home. So we are doing our very best to stay on top of this, to containing it, and to quickly identify any cases, and of course then take immediate action, the appropriate action that is that we know so well now, and following, of course, strictly the guidelines from the Health Department and from CDC. Today's Star Tribune article, you may well have seen it, front page, the lead article. Spike in cases could derail holidays. Family get-togethers seen as high risk as deaths in Minnesota exceed 2,900. A fresh wave of COVID-19 infections in Minnesota is sending record numbers of patients to the hospital as families are finalizing their plans for Thanksgiving gatherings. On Sunday, just yesterday, the Minnesota Department of Health added 7,559 new cases of COVID-19, bringing the state's overall tally of cases to more than 223,000. But just one day new cases, 7,559. That is a new record. It was a very short few days ago, we were talking about the striking number of 3,000+. And now we are already at 7,559. So that is indeed alarming. COVID is spreading rapidly in the state of Minnesota at this time, and that's all areas of Minnesota, not just in the metro area. The rate of people being admitted to the hospital for COVID in Minnesota has never been higher. And we need to keep this in mind too, that while hospital beds may still be open, the rise in COVID cases is sending healthcare workers into isolation like everyone else, creating staffing shortages. So it isn't just a matter of whether or not the state has some empty beds in the hospitals, it's also, do they have staff to care for new patients in those beds? So it's, of course, at a critical point at this time in our state. As case counts skyrocket, public health experts say the safest way to celebrate Thanksgiving in person is only with immediate household members. That's what I'm going to be doing. It's going to be only my wife and me this time around. We have 3 children. One is in Duluth, one is in Madison, and one is in the Twin Cities. And we're not going to be getting together just because it's too high a risk at this point. And so think long and hard about what your Thanksgiving plans are, because, and of course, a lot of people are canceling or substantially downsizing who they're getting together with. Of course, here on our campus, here at Episcopal Homes or at any of our 10 communities, we have to always keep in mind that virtually everybody, just about everybody, is in a high-risk category. Because if you think about the age, and you think about some other underlying health conditions, whether it be heart or other issues, and you might then add to that some people that are overweight, and I mean, you're pretty close to 100% of our population are residents and staff that are in a higher risk category. And so just because one of us might not have symptoms, remember, we could pass it to somebody else who could get severely sick or even die of it. So that's why it's so important that we do all the little things that we know to do, and they make a difference. They really do. And that is wearing a mask at all times, and frequent hand washing, staying at least minimum 6 feet apart, and if you have any symptoms, isolate and get tested. Because even if you have it, even if you have it, or if I have it, if a few of us have it that are here at Episcopal Homes at this time, if we are practicing those techniques, it's likely to simply stay with that one person, and they don't know they've had it, they never will, and it's just going to run its course with that one person, and it is no longer an issue. And then they've passed it on to no one if we are vigilant with these practices, these little important things that really matter. Okay, they make the difference. All right, birthdays for this week. So happy birthday to these folks: Dolores Everson at the Gardens, Sally Jasko at Seabury, Sharon Otters, Episcopal Church Home, Joan Wilson, Cornelia House, Karen Faust at Seabury, Kuk Kim Trung at Seabury, Doris Shenham, Midway Point, and Carol Osell at Episcopal Church Home. Happy birthday to all of you. I will not torture you with singing it right now, all right? But happy birthday to all of you. Delighted. Make it a special day as much as you can. And if nobody's going to come see you, reach out to somebody, all right? But hopefully people are reaching out to you through phone, FaceTime, through whatever Zoom, whatever other method. And of course, as we know, at our skilled care and at our assisted living, visitation is very restricted. It has to be, we're following health department guidelines based on active cases and also the positivity rate in Ramsey County. But at our other communities, visitors are allowed, so we just have to be vigilant at all times. Okay, everybody. Okay, take care everyone. Great to see you, and I will see you on Thursday. Bye-bye.